Could it be nausea?
Could
it be vertigo? Could it be the flu?
Maybe you're pregnant.
Maybe you're pregnant.
There are a lot of different sources that could be causing vertigo, nausea, and dizziness post-concussion. And I think the trick is trying to figure out what it is, what's causing it, so you can make it better.
Mm-hmm. And avoid those things for sure. Yes. I'm Lisa Khera, coming in from In Balance Pilates. Welcome to our show, Concussions Anonymous.
And my name is Karen Monet, and I'm here from the Opticom Clinic to help you figure out what are some of the causes of your vertigo or your perceptual processing problems causing that dizziness and nausea, so that you can get better and get rid of these symptoms that can be so debilitating.
Mm-hmm. Definitely. I have a lot of clients that when they're experiencing that vertigo, I mean, it's a feeling that you just can't escape, right? Finally you can find things to feel better, but at times when it comes on and hits you, it can be a really, really annoying symptom to have to deal with. And I know you experienced
I'm
a lot
experiencing
yourself.
it right now.
Mm-hmm.
It's really frustrating.
Mm-hmm.
So what I want to do is I want to get right into it with a bit of a personal story. I'm sure many of you will be able to relate, although it wasn't a concussion that led to this sense of vertigo, nausea, and difficulty. We didn't know what caused it, and I went through a year and a half of medical appointments and scans and analyses to figure out why I'm having this occasional case of vertigo. Now I'm experiencing it right now, so I'm going to be on my way to my physiotherapist to help me with my Epley maneuvers. If any of you know what that is, you'll understand. But when it first presented, I got out of bed and I rolled right down onto the floor, and I couldn't figure out why this is happening. Do I have the flu?
Mm-hmm.
Did I eat something last night? Do I have food poisoning? What is going on?
Mm-hmm.
Now this went on for about 2 weeks. Thought, okay, it can't be a flu because the flu should be over. I would walk down the hallway sideways and I would lean on the wall, and I would have to hold things to stay upright.
Mm-hmm.
I was a mess in the kitchen, leaning and falling back, opening the fridge door. I just keep going. I was a mess, and it was a sensation that the world was crooked, and I couldn't make it straight. And I never got sick, but I always had that
crazy kitchen.
That's why I was living in the crazy kitchen.
Actually, people can let us know in the comments if you've experienced any vertigo yourself. Definitely let us know in the comments.
Great, because we'll answer those questions.
Mm-hmm.
We will be posting this. We're filming Facebook Live, but we're also filming for YouTube.
Mm-hmm.
And in YouTube, we will put all the links and points and where to go.
Definitely.
And those questions we get from you, we'll post some of the answers on there as well. So, so for my story, I had a brain scan. Yeah, let's find out if you have some kind of tumor. Mm-hmm. Do I have Meniere's disease? These are scary things. It wasn't a scary thing that was going on. It was very easy to fix, but it took a year and a half to figure out what it is. And I don't want you to go a year and a half trying to figure out what your nausea is coming from. So, pregnancy, not a chance, but she still did a blood test for pregnancy. I don't know, pregnant. No, it didn't happen. What else did they study? All of my hormones, my blood tests, what kind of levels did I have? Maybe I had some kind of thyroid issue going on. I mean, this is scary, trying to figure out what is going on, and then it would go away. And then 6 months later,
kind of flare up,
it would flare up, be terrible, and then it would go away. So I don't know what caused it. I don't know what stopped it. And then I realized I love Zumba. I love aerobics. I've been doing it since the 80s with Jane Fonda.
Nice, awesome.
But I couldn't do it anymore because the going down and the lifting up and the going down.
Now,
and
would
the
you
lifting
feel
up.
dizzy within the class?
The next day, I would be out.
Okay,
so I can't do Zumba. I can't do these exercises. What is it that's causing? So again, I've got a few hints. We talk about mindfulness, about trying to solve an issue by understanding it. So what is it that triggered it? What is it that I might have done that caused it to get worse? So as I had my episodes, I became more and more aware of what those triggers were. And for me, it was motion. It was motion in a certain direction. I cannot, to this day, go down under my desk and even just doing that now makes me feel,
Yeah.
because I'm triggered right now.
Okay.
But going down under my desk to grab
To
something.
reach something.
So
Okay.
now I know I have to kneel down and I have to
Mhm.
go at it straight. I
Mhm.
cannot do that movement.
Mhm.
What I have is a condition called benign paroxysmal, I have to look it up because it's a tongue twister. Benign paroxysmal positional vertigo, in short, BPPV. Now, how did I find out that that's what it was? A trip to the emergency room. Okay?
Okay.
So, again, a scary situation. I was having a massage. We're going to talk about massage later and why it's important to go to a qualified massage therapist. She was doing massage and needles.
Okay.
Sorry, acupuncture.
Mhm. Mhm.
And my face, one
Mhm.
half of my face turned purple. Okay, I'm not even going to get
Oh
into
my
that now,
gosh,
but what
okay.
that meant was we thought I was having a stroke.
Oh my goodness.
So she drove me to the
That's
emergency
scary.
room. Absolutely. She drove me to the emergency room. They hooked me up on all the heart monitors and things. I got right in, right through.
Mhm.
I mean, I showed her the picture. This was my face half an hour ago. They're like, okay, you're in.
Okay.
Triage number 1, right into a bed, hooked up to all the monitors and stuff. I feel
Mhm.
terribly bad that I took the space of somebody who should have maybe been in there more than me. But in any case, the ER doctor, when I
Mhm.
told him about my symptoms and about my dizziness, he said, okay, lie on the bed and look this way. And then lie in the bed and look that way. And I said, oh my God, everything's turning. He goes, oh, you have BPPV. That's an easy fix. I'll have you fixed up in no time.
Mhm.
He took me through the Epley maneuvers.
Mhm.
I left the hospital after having this condition. I think I was in 2 weeks again of not knowing what it was.
And that had already
And-
been like a year.
Oh, it was a year and a
That
half
was
since I
okay.
had the first bout. And I think this would have been my 4th 2-week bout of it.
Okay.
And I mean, it affects me at work. I can't do my job. I sit there trying to like do things.
Plus
I'm
the stress
nauseous,
of not knowing what it is, right?
thinking
That's
I have some kind of
yeah.
incurable disease that's going to go on forever. Now,
Mhm.
I do have this forever. This is something that I will have forever.
Mhm.
But it is something that when I get it, when I feel it's coming,
Mhm.
it goes away. Now, the reason why we have this on our Concussions Anonymous video is because a lot of people with concussions can also contract BPPV. Because how it works, in your ear, you have 3 hula hoops. That's how it was described to me.
Mhm.
Those hula hoops have little crystals on the end of hairs.
Mhm.
And those crystals on the end of hairs, when you move this way, this way, this way, those crystals move and they tell your body where you are in space. We're going to talk about that a little bit in a minute.
Mhm.
But if those crystals come loose, they tickle the hairs and they make you think that you are in a different position. So what happened, now I look back and I think, yeah, I hit my head a few times around the time that this started happening. You know, they say you've got a screw loose. I had a screw loose in my ear. And that screw, that thing was tickling my vestibular hairs in those canals, and we'll put information up on the YouTube channel about all of this,
Mhm.
and making me think that I was going the wrong direction. When you do an Epley maneuver with a specialist who understands how to do it, now I would suggest you call around for physiotherapists or vestibular therapists who specialize in vestibular conditions and doing an Epley maneuver. Yes, you can go online to, I've got a note here, the VIDA, which is the vestibular organization. They have all sorts of information on how you can do it yourself. Don't do it yourself the first time. Get it done by a professional.
Mhm.
They will tell you which direction you have problems, because there are 3 and they can go different directions. Is it left or right, up or down? You need to have that determined so that you can find out which maneuver you need to do.
Mhm.
Now, I had to call over, we're in an area of town, which I think we must have about 100 physiotherapists here.
Mhm.
They all referred me to the same guy. He's
Okay.
the guy. He knows how to do it. He'll sort you out. So,
Mhm.
number 1, be aware of what's causing it. The ER doctor said, lie on your side. Does it spin? Does it spin this way? Yes, no. Okay, that was, not a problem.
Mhm.
So you need to be aware and mark down what your symptoms are when they happen. I go
Mhm.
under the desk. When I go
What
under the desk and
position you're
turn,
in, yeah.
hey,
What was
that
your neck
causes me to
doing?
become
What
dizzy.
was- yeah.
Because it's positional vertigo and that it can be corrected. So
Mhm.
fortunately, I was corrected. What I do is all the people that come in our clinic who
Mhm.
report with vestibular issues,
Mhm.
with balance issues, with nausea, I tell
Mhm.
them, have you been tested for BPPV?
Okay.
And if they say no, I say, go and get yourself tested, because it's an easy fix and it's one of many things that could be a problem with a concussion,
Mhm.
but it's an easy fix. Now, it may not be. There are other types of conditions that can cause this. Now, we talked a little bit about mindfulness and awareness, and proprioception, I think, is an important part of the vestibular system, knowing where you are in space.
Definitely.
My crystals were telling me I was in not where I thought I was. But proprioception and understanding, you can speak a little bit on that?
Yeah, definitely just that whole proprioception, knowing where your body is in space, knowing that difference, you know, you're following along with an exercise program, just having that body awareness of being able to balance, being able to catch yourself when you become a little bit off of balance, right? So working with balance exercises in Pilates.
Strong core.
Yeah, strengthening the core, breathing exercises. And we even mentioned before, you know, if you're having those times where you're feeling vertigo and it's putting you off and you're feeling really uncomfortable, and let's say you haven't yet figured out the pattern and what it is, right? There can be those times when you're quite reluctant to go to that place or do that position, right? If you're not yet unsure of the causes, right? And so you might simply be avoiding a certain movement or a certain, as you said, you were avoiding Zumba because you were
I still will always have to avoid Zumba, but I can now know that I can do certain exercises without that one movement.
Definitely.
It would be a good excuse to say, oh, I'm sorry, honey, I can't do laundry because I have to bend down, I have to go from the washer and put stuff down in the dryer. Okay, well, yeah, you could use that as an excuse, but you can also fix it so that you know I put stuff in a basket, then I go down beside the dryer and put the stuff in the dryer. So I'm not doing that repetitive motion that sets me up. So unfortunately, I still have to do laundry.
And again, same with the way it relates to Pilates in terms of just how your body tends to be in static posture and dynamic posture.
Okay.
So if you're the type of person that tends to have like a bit of a head shift or a head tilt or a head forward posture, whatever those postural things that your body tends to do, that alone can exacerbate, right? Depending on where your cervical spine and how that's exacerbating.
I'm glad you mentioned that, because one of the things we deal a lot with optometrists, and we make sure that anybody who we see who's had a concussion gets a vision assessment with an optometrist. Not all optometrists will look at the positioning of your head and your eyes in trying to establish why you're having some of these vision issues. But what you're saying about postural, if you can combine the postural with the visual and put those things in balance, you need to be seeing straight. If everything you're looking at is crooked, your brain starts to think that you're crooked. So
even in terms of grounding your body, like when you're doing certain exercises, vestibular exercises, vision therapy exercises, actually having, you know, both feet on the ground, thinking about how your posture is.
Which we should be better right now.
Yeah, so that we're always thinking about, what is the body tending to do and adjust that way.
So there are a lot of causes and effects. There are a lot of potential issues that could be causing these symptoms. There are a lot of different inner ear conditions and neurological conditions and visual conditions that can contribute to this sense of nausea, this sense of vertigo, this imbalance, this why am I feeling so sick all the time. It may have nothing to do with what you're eating. It may have to do with how your brain is sensing yourself in space. Now, there are a couple of resources. Vestibular.org is a site that I found when I was trying to figure out what was going on with me. So if you have any nausea, balance, disorientation issues, take a look at the website. They go through a whole bunch of different conditions that might be happening, and they now have a toolkit. It's called a new patient toolkit, and so you can go in and enter what some of your symptoms are. They say get started on your journey to diagnosis and recovery. So a very good site, a very powerful and well supported evidence-based site to finding solutions for your vestibular issues.
And obviously too, as it comes to, you know, we talked about pacing last week, but on the times that you are knowing that things are flared up a bit more, just being mindful of taking it easy, and especially with the slippery weather, if you're knowing your balance is a bit more off, or, you know, just kind of readjusting your energy reserves and where you're spending your energy.
One of our next episodes is going to be on massage, and personally for my massage, it wasn't necessarily for fun and relief. It was to fix the fact that I'm tense on one side, and in doing that it pulls out my rib, and in doing that it puts me, like it contributes to a sense of discomfort and deformity.
Definitely. Misalignment.
Misalignment,
and,
exactly, not
And
deformity.
it affects your breathing and just everything. The way your body's
Sleeping, all
feeling.
sorts of things. So we'll talk about massage.
We'll talk about
another
massage,
event.
and we'll definitely in the comments on our YouTube channel we will add in some of the clinics that we
Right.
know of, some
Yeah.
of the vestibular clinics.
I
We know
think
of some
on the
great physiotherapists.
vestibular.org site you can find a therapist. We'll make sure that it's Canadian. I think it might be just American, but we'll make sure that we have links for you.
Definitely.
One thing I would like to add before we go, I know we're already at about 16 minutes, is that one of the conditions that can add to perceptual vestibular issues and feeling like your world is off kilter is visual stress. So take a look at our website at opticom.ca, and under the who we help, there's a section on other conditions. And so there are diagnoses of, there's one called persistent postural perceptual dizziness. That basically is visual stress. So if someone has diagnosed you as having PPPD, that is a perceptual dizziness. It has to do with the way the brain is perceiving information. It is perceiving it to be crooked. So it's a neurological issue. We can help with many different types of tools to help with reducing the trigger of the brain to make it feel like it's off balance and dizzy. So one of the key symptoms of visual stress is dizziness, nausea, depth perception issues. So consider that as well. You're not going to find that on Vita because they don't really understand it yet and it's not fully supported. We have a lot of research on our website, so if you want to go there, you'll find out about that as well. We don't want that to miss out. I was actually just coming from the rehab hospital where I was showing them what visual stress did and how they can help with this visual and vestibular issues that a lot of their patients there are suffering from.
Definitely. And as I mentioned before with Pilates, you can definitely go to my website, which is imbalancepilates.ca. And I do offer some online classes, some class replays, and some virtual stuff. So if it's something that you can't get out to, if you don't want to be in a
do it on
big
your own
open
time.
room, do it on your own time. So I'm definitely there to help you out with the whole breathing and proprioception, balance issues.
Good.
And that,
We have so much to offer, and we can't wait to have more shows where we can talk to you about more things that we've shared, we've experienced, we've learned from our clients or our patients, and get that information out to you so that you can get better. That's what we hope for.
And reach out to us again if you'd like to be a guest on our show. We welcome hearing your stories, and so reach out, get in touch. We'd be happy to have you on.
All right, well, have a great day, enjoy the rest of it, and we'll see you soon.
Exactly. Thanks for watching Concussions Anonymous.
Bye.
Bye.